The most important thing is to check whether your eye condition remains stable over time. It's good to check once every 6 months or a year to ensure your endothelial cells are healthy and nothing abnormal is happening. Hello, I'm Director Han from Eye Clinic Siblings. Today, we'll talk about the essential things to check before and after lens implantation surgery. There are always certain conditions that must be checked when getting lens implant surgery, but some people don't know about these things at all. I'll just go ahead with lens implantation. I don't think lens implants are right for me. I'll just get LASIK instead. There are people who decide like that without knowing. Let's go over how to know if lens implantation suits your eyes and what you should check beforehand. First, you need to check your endothelial cells. What are endothelial cells? Well, our cornea is made of 5 layers. The innermost layer is made up of endothelial cells. Their role is to maintain the transparency of the cornea. That sounds a bit complicated, right? Let me explain again. The endothelial cells act like a pump. They constantly pump out water so that it doesn't accumulate in the cornea. Thanks to that, our cornea stays clear. If you didn't have endothelial cells, water would build up and your eyes would look cloudy, like fish eyes. That's how important the endothelial cells are. We have the most endothelial cells when we're born. They gradually decrease over the course of our lifetime. Their key characteristic is that they do not regenerate. Since they don't regenerate, it's important to avoid damage or loss. That's why it's crucial to check if you have enough cells per unit area. Also check whether they are healthy in shape and safe enough for surgery. It's important to examine these things before lens implantation surgery. Second, you need to check the anterior chamber depth. It refers to the distance from the cornea to the natural lens. One of the biggest concerns with lens implantation is the risk of developing cataracts. It happens to about 1 in 1,000 patients. The shallower the anterior chamber, the higher the risk. That's why surgeons always check whether the depth is above or below 2.8 millimeters. Each clinic is different, but the guideline is usually between 2.8 and 3.0 millimeters. If it's shallower than that, surgery may be postponed or not recommended. If it's deeper, there's no issue. Even if it's less than 2.8 millimeters, factors like age and degree of myopia are considered. The decision is made based on an overall judgment. Even if the depth is under 2.8 millimeters, if the patient has severe myopia and the potential risk of cataract surgery is worth taking, I consider how satisfied the patient will likely be after the surgery. If the expected benefits clearly outweigh the risks, I fully explain everything to the patient and proceed with the surgery. In many cases, patient satisfaction afterward is very high, so it's best to discuss the anterior chamber depth results and decide together. Third, check carefully if there are any signs of cataracts. Use a slit lamp microscope to check if the natural lens is still clear. As mentioned, cataracts may rarely progress after lens implantation. If a cataract already exists, it may progress faster after surgery. So if a cataract is clearly present, lens implantation is not recommended. If it's just in the early stages and very mild, and if the anterior chamber depth is sufficient, surgery can still be considered. So you have to weigh how severe the patient's myopia is, how fast the cataract is likely to progress based on their age, or whether it has remained stable during observation. All of these factors should be considered from multiple angles before deciding. I feel like I'm sounding too stiff again. I want to make this more relaxed. But after surgery, make sure to check at least this one thing. First, you might feel a worry ache in the eye after surgery. That's a dialect. Not sure how to express it. It's like a deep, achy pain. Also, if your eyes become red and bloodshot, it may be a sign that your intraocular pressure has increased. So it's important to check that your eye pressure remains stable. Since it's surgery, you should of course check for any signs of infection or inflammation. Second, you might experience scattered or split light, similar to worsening astigmatism. In such cases, check if the lens has rotated inside the eye, and make sure the lens size is correct and is sitting properly and stably in the eye. Even if you don't have symptoms like that, you should still get your eyes checked on day 1, week 1, month 1, and month 2 after surgery, because you never know what could happen. You might rub your eyes in your sleep, or your eyes might get red, and you might ignore it thinking it's just allergies. That's why it's best to come to the clinic and have your eyes carefully examined to make sure everything is fine. I couldn't wrap up properly at the end. What was I saying again? What I said earlier was actually pretty good. Actually, this isn't the end. The most important thing is to make sure your eye condition stays stable over time. Even people with no eye issues usually get a checkup once a year. So once every 6 months or a year, it's good to check whether the implanted lens is still stable and fine. And also your corneal endothelial cells, check if they're being maintained well. Just checking once in a while should be enough. Today, we looked at the essential things to check for lens implantation surgery. Please don't forget these points and keep them in mind so that you can maintain bright, healthy eyes after surgery. If you found this video helpful, please like and subscribe. And if you leave a comment, we'll gladly reply with sincerity. This has been Director Han from Eye Clinic Siblings.